dry and protecting the patients from aspiration or ingestion for different foreign objects. But I think one thing that constantly is forgotten about is the dental dam's ability to reduce microbial contamination. And there's studies that show that it can do this up to 99%. So as we kind of get into this whole area of needing to reduce aerosols, I think we'll definitely see a big resurgence for this. And Mary has been a very faithful trooper in our camp for dental dam for many, many years, decades, even with Coltene. And so I definitely want to thank her for making the time to come on and try to give us a little bit more, show us a little bit of knowledge and how the dam can be utilized to kind of give us just some basics and backgrounds to arm us to go into offices to answer questions that might potentially come up. So that's what I got.
All right, Mary, I think we should be ready to go, and I am recording this, so anybody that can't make it will have it available after the webinar. So
okay.
Mary, it's all you. Thanks so much.
Thank you.
Hey, Pete, can we ask everyone to mute themselves before Mary starts? There's got a lot of noise in the background still.
Okay, we all right? Well, good afternoon, everybody. I had received some questions, so as I'm going through the slides, I know you, hopefully you had reviewed these, but as we go through them again, I want to address some of the questions that you have had. And of course, we know that the importance of using dental dam in the age of the coronavirus. And as Kyle was stating, is that dentistry is one of the high-risk areas that produces microbial contamination through aerosol. So it is really, really important that we stress the use of dental dam. Over the weekend, I was looking at some of the CDC guidelines, and there was a recent posting on OSHA guidelines where they did indicate dental dam for usage as one of the engineering controls to control the aerosol contamination. Back in the original bloodborne pathogens regulations standards that were passed years ago, they had dental dam issued as an engineering control in order to control the contamination. But for some reason, over the years, I noticed that CDC, when I looked at their 2003 MMWR listing, they didn't even have that listed as an engineering control, which really surprises me. I think it should. I think dental dams should be mandated for use, but of course, I don't know if there's just politics involved with that. I think the biggest part why dentists don't use dental dam, it's a mindset thing. We have to go in there and give them a positive mindset for using dental dam, because really there is a learning curve with it. But once you get beyond that, the dental dam is of great benefit. And as you can see of what I have listed, the other benefits of using dental dam in my upcoming slide here. Besides the infection control, the access and visibility, moisture control, we know about all those. So this is nothing new to any of us. There was a question about purchase of dental dam equipment for placing dental dam. Well, we have our simple dam kit. That's a very basic kit. It's a starter, all right? So if someone is a little apprehensive about spending a lot of money to invest in the instrumentation, then a simple dam kit would be appropriate. It also has a video that will give instruction on dental dam application techniques. So this is certainly a starter. And you always want to specify that buying a kit is usually competitively priced versus buying the items separately. So That's a place to start. Personally, I would also throw in the Fiesta 9 clamp pack, whether they prefer winged or wingless, which we'll get into that in a few minutes. So we all know about dental dam. I think most of us realize that it comes in a variety of colors and different gauges or thicknesses. Generally, when an operator is selecting a dental dam, the darker colors are for restorative treatment. Some endodontists still like the light colored dam, although now with the technology, with the lighting technology we have, we really don't have to worry about light transferring onto the operating field, which is the benefit of the light colored dam. And I know a lot of endodontists prefer the green dental dam. So anyhow, bottom line is, the heavier the gauge, the more gingival retraction you'll get. The most popular the most popular gauge is the medium gauge. I personally used heavy gauge because I liked a little bit more of the retraction that it provided. And we know it comes in ready cut 5-inch and 6-inch pieces. Those of you, I don't know how are you promoting the ElastiDam at all? For offices that may be reluctant to use dental dam, the ElastiDam would be a good starter, and I'll tell you why. Besides the fact of the low protein and the powder-free issue, the modulus of elasticity has been adjusted. It's 30% more elastic. Bottom line is easier to apply because it stretches more readily. And so that might be a better dam to recommend instead of the standard material. If we have any questions as I'm going along, please interject. I do, like I said, I do have a list of some questions, but if there's some additional questions, I like to answer them as we proceed through the presentation. So again, your ElastiDam, we know it's in the blue and the green, and it's 5 or 6-inch ready cut sheets. Everyone should know, I'm pretty sure, about the latex-free alternatives. Our frame FlexiDam, or the ready cut FlexiDam material. One nice thing about the frame FlexiDam, as you can see in the lower right hand image, when you're taking radiographs for endodontic therapy, the frame is very user friendly. You can get your apparatus in place to take your radiograph without having to worry about removing the frame. Normally the procedure when you have a frame is you have to remove the frame to get access to take the radiograph. So this makes it much more readily available and easier to use. And of course, with it being totally disposable, in reality, there was a study that was done at, I think it was University of Indiana, that they showed that actually using the frame FlexiDam, it was more economically feasible to use that versus the traditional ready cut material, because you didn't have to sterilize it, and the ease of use and all the other benefits that go with using a frame that's integrated into the dental dam. And again, the same thing is done with the modulus of elasticity. That's why the non-latex dam is easier to apply, because of that modulus having been adjusted. So here is it. Probably there's 2 reasons why dentists don't use dental dam. They think it's too time consuming to apply, and then they get totally wiped out when it comes to selecting the appropriate clamp. It can be very confusing. So let's see, I think we had several clamp questions actually this morning. Okay, so we know there's a winged and wingless style. So you're familiar with the anatomical aspects of these clamps. And both those clamps are applied differently, which we'll get into in a little bit. But first of all, when there's a couple things you need to know about a clamp. First thing is it has to be stable. And in order for it to be stable on the tooth, you need 4-point contact. If you look at the image on the right, you can see the 4 points that we're referring to. There's a set of points on the mesial aspect of the clamp, and there's a set of points that are placed on the distal aspect of the clamp. And of course, the bow is placed generally to the distal of the tooth. So let's look at the bottom of the too large, too small, and the correct. What happens is if we don't have that 4-point contact, we select something that's too large, obviously it's not going to stay on. Something too small, we don't have enough contact of the clamp to the tooth surface. So we want to place the clamp, and it should look what's shown in the correct image. So that's the first thing. Whether an operator chooses winged or wingless has to do, I guess, basically with comfort level and what they learned in dental school. Unfortunately, sometimes the dental schools teach the technique with the wing clamp to place the wing clamp on the tooth and then try to stretch the dam over the clamp and tooth, and the dam tears. Well, that's because they're asking the dam to overcompensate by trying to go over the wings. It basically, it will not stretch to that extent without some type of tearing. So that's an issue there. We'll talk about in a few minutes about the winged and wingless too, but we had a question about sterilization of clamps and the breakage of clamps. All right, so clamps, basically what happens is the metal will fatigue. Most of the time when a clamp breaks, it's usually a molar clamp. And where it fatigues is right in the center of the bow. And so the reason could be repeated usage. There was a question about how many times can you use a clamp before you have to reorder. Well, I was researching to see if there were any studies that were done to determine this issue, and I couldn't find anything. But let me say this way, to try to do a study to determine that, you would have to mark the clamp and keep track of the clamp as to how many times it's sterilized and used, which can really be quite an ordeal to do. And maybe that's the reason why there aren't any studies. Bottom line is, when the clamp no longer obviously stays on the tooth, you need to replace it. Clamps can be overstretched. That's another problem. Some individuals have the tendency to insert the clamp forceps into the clamp, and then they'll open that clamp forceps really wide, and the clamp is sprung. And once it's sprung, it's no longer useful. You have to replace it. It's not going to stay on the tooth. So it could be an operator issue. You only need to engage the clamp to the point where it'll stay on the forceps without over-engaging it. And you need only to open it wide enough to clear the tooth to seat it. So that could be another issue. So bottom line on that, your clamp breaks due to the metal fatigue. We do overextending the clamp. I do recommend putting a safety floss on the clamp that goes into the patient's mouth. I do have some views that show the floss ligation, and we'll get into that in a few minutes. Here, let me proceed to the next slide. So one thing I tell doctors, or even dental assistants, sometimes doctors get a little offended because they think, oh my God, I know some of these clamps, you don't have to, color code them. I just tell, it's easy identification. Your assistant, if they're learning how to apply dental dam, it's easy for them to identify what clamp to use where. And as you know, it comes in winged and wingless scenario. And the other thing I stress too is that the clamps are on a clamp board, which keeps everything organized. So when we're selecting a clamp for a tooth, we need to determine whether it's an anterior or a posterior tooth, because the size of the clamp, of course, is going to vary. And then we look at the condition of the tooth. Is it structurally compromised, or is it intact? The eruption pattern, partially or fully erupted, those will make a difference in terms of what style clamp we select. Now, generally speaking, for the anterior, there's not too many issues with the anterior. The 9 is the most popular. The 9, as you can see, the W that precedes the number means wingless. And the 9 has little tiny wings, as you can see in your slide. Now, if a person were using a W9, you actually have to put the dam on the tooth first and then put the W9 to position. The 212 is a specialty clamp. It's a retractor style clamp. Please do not recommend using that clamp as a sole means of retaining the dental dam. It is strictly used for gingival retraction when other retaining devices are used. As shown in the image on your lower right, we have Wedgett's cord retaining the dental dam, and we're using a 212 to retract for a class 5 on tooth number 8. So that's for the anterior. Bicuspids, pretty simple. The 2 and 2A are usually the go-to clamps for the bicuspids. Now, the 2A, yes.
Mary,
yes.
I just have a question. Could you go back to that picture, that 212 clamp? I didn't see any holes in it to...
Yeah, I'm sorry. I should have mentioned. Thank you for bringing that up. Yes, the 212 doesn't have holes. Can you see those notches, though? Do you see the notches? There's a set of notches on each side of the jaws of the clamp. Let's see. I don't know. Can I don't know if I point to them, if you'd be able to see this or not.
We'll be able to see your cursor, Mary. I think it's purple right now, so that arrow, if you want to,
yeah,
yep, we can see that.
There's a notch.
Thank you.
There's a notch. There's a notch, and there's a notch. The reason why there's a set of notches is because if you're placing this on the lower or the upper arch, you're going to have the clamp at a different position. You see this, I call this a ski slope. You see that ski slope here? That goes to the facial. So this is the correct position for the upper arch placement. And you would engage, the operator engages the notches that are closest to the hand that has the forceps. So whatever their dominant hand is that's holding the forceps, they would engage the notches. They would be in chair side position, and then they would seat the clamp so that the jaws gently slide and glide along the tooth surface very gently until the jaws are seated at the gingival area, and the jaws are retracting the gingival tissues. So these are the jaws right here, these tiny little things right here. All right, that's what is retracting the tissue. Same thing with the number 9 clamp. You see this ski slope here? It kind of slopes down. I've seen these on backwards in textbooks. Could you believe that? This is the correct way to place a number 9 clamp or a W9. The ski slope here goes to the facial aspect. This is an upper arch placement here. So, so obviously, if you're on the lower arch, these are reversed. Okay, that would be reversed. Actually, the way this is shown here, this is how it would go in on the lower arch, because there's your slope here. That would be the way the clamp is held to be placed for the lower arch. And same thing with this clamp. So you can see how this has been reversed to go to the upper arch. It's been 360, basically. Does that answer your question?
Yes, thank you, Mary.
Okay. All right. So I was talking about the 2A. The A after the number on the clamp means that the jaws are slightly moved in an apical direction. So what does that mean? It means it gives the clamp a little more gripping power. So usually the 2A, if you have a bicuspid that's a little bit structurally compromised, and maybe it's questionable whether it's going to stay on the tooth, you would go with the 2A. The 2 is your kind of your standard bicuspid clamp. Now the 00, that could be used on an anterior tooth if need be, and a small bicuspid. You know, in all the years I've been in dentistry, I don't think I've ever used any of the only ones I've used is the 2 and the 2A. So again, it depends on the circumstances. It depends on the condition of the tooth, because you could have a badly broken down tooth where 00 may just very well work if you have to do endo on that tooth, for example. But in any case, that kind of gives you some background on that. Now, this is where we, this is where we get in trouble, is the molars. All right, let me explain to you about the jaw styles. By that, I mean, we have flat jaws, we have curved or cup jaws, we have the curved and cup jaws, and the points of the jaws go downward in an apical direction, such as your 14A and your 8A, your 8A. The only difference between these two is that this is for a smaller molar, and that would be for your larger molar. And then you have the serrated jaw clamps, like your 12A and 13A. Normally, when you have a clamp where one jaw is larger than the other, the large side of the jaw goes on the buccal aspect of the tooth. So these kind of run in pairs. That's why you've got your 12A and 13A. So essentially, your partially erupted teeth, you're going to use the subgingival style clamps. Your flat jaws generally fit better on the molar, the mandibular arch. Your curved jaws usually fit better on the maxillary arch. There are some exceptions to the rule, not to confuse you, but let's say, for example, we're restoring the last tooth in the arch and it's on the upper arch, it's tooth number 15. And we have to put a matrix band on that tooth because we got a class 2 restoration that we're going to be doing. I would use a flat-jawed clamp versus the cup-jawed clamps because my matrix will seat more readily. See, the whole idea is to keep the clamp in position and still get your matrix on. That's the ideal situation. But sometimes, depending on how deep the preparation is, the decay is, and you can't do that. You have to switch the matrix system for the clamp, do the restoration, and then put the matrix, put the clamp back into position after the restoration is placed. So you try not to do that, but sometimes that is a situation. So essentially, what we have over here is the large molar clamps, the flat jaws, showing your winged version and your wingless. The small to medium is the 3 series. And then your upper molars. The 8 is a universal, basically, upper molar clamp. And then your partially erupted clamps here. 14 is also a partially erupted clamp to use. Notice how the sizes increase. This would be for a smaller molar, intermediate molar, the 14, 14A for your larger molar. And then the W56, that is also universal molar. Those jaws are sort of, they're in between the flat and the real cupped. They are curved, but not to the extent of the cupped style like this one. And that's what makes it universal. We only make a W56. I don't know why we never made the number 56, but whatever reason. So I hope that kind of helps you out with the clamp selection. There was another question about, they had a couple of offices that break clamps. Well, number one, I would find out, if you go in an office and say, I haven't had clamps breaking, well, find out if it's ours to begin with. If it is a hygienic clamp, ideally what we used to do, I don't know if you're still doing it, but we would collect the clamp and send it into corporate office to have them analyzed to see why perhaps it broke. You could have a manufacturing defect, that's always possible. But like I said, it could be other issues where they overextended the clamp and it just, the metal was fatigued and it broke. And also, excuse me, the metal could just fatigue in general from overusage. It's just like, well, it's time we replace the clamp because it's through with its shelf life. But anyhow, so that's one thing. The other thing is, if it's not one of our clamps, find out what clamps are breaking. You know, is it the molar clamps? If they could identify, well, yeah, it's usually a 14A or it's usually an 8 or whatever. Find out which ones they are, because if they're generally molar clamps, it's just simply because the metal fatigue, because the tension, most of the tension when you open and close the clamps are right in the center of the bow, and that's exactly where it breaks. And that's because the metal fatigues in that area, and there's really nothing you can do about it. I mean, eventually it does fatigue. I do notice, and I do think sterilization, I'm in favor of the high heat sterilization, but I remember when we used cold sterilization for clamps, it didn't seem like we had as much breakage. So I do think that the high heat temperatures may have some effect eventually on the metallurgy. So I think it's a kind of a combination of the high heat sterilization mixed with continued usage. So I hope that helps in that respect. Okay. All right. Well, I hope everybody knows about Wedgett's cord. The Wedgett's cord, I love those things. We started out, of course, with the latex. We had an extra small in the latex product, but it's not as popular. So I think we may be reconsidering other issues with that. But the orange and the yellow are latex products. Orange is large, the yellow is small, and then we have the non-latex available in the lime green, which is small, and the turquoise is size large. And so basically, I just love those things because before we used to cut a corner, you may have some dentists say, well, I could just cut a corner of the dental dam off and put that in place. Yeah, you could do that, but the thing is it's too bulky. We used to do that before Wedgett's cord came along. And what would happen is, in order for the dam to stay secure, you would have to put a rather bulky piece of cut corner in that area to make it stay. Whereas the Wedgett cord is nice and thin, and then you stretch it, and then you place it. Someone had a question about the go-to size. When you're selecting your sizing for your Wedgett cord, it depends on how tight the contact is. So size small is generally for a tight to medium contact, and size large would be for an individual who has contact, but it's not that tight. So I find the size small is probably the more popular size. Okay, so essentially
Mary, I've got a question about the Wedgetts before we move on.
Sure.
This is Ben. So you talked about, people may not necessarily like dental dam because they can't figure out how to choose a clamp. But with Wedgetts, there's no clamp selection made. So it seems like it would be a lot easier if they could just use Wedgetts more often than using clamps. So are there any situations where you cannot use a Wedgett? I mean, I understand that if there's no contact at all, if they're missing a tooth or something like that, but are there any other situations where you cannot use a Wedgett? And it looks like you don't typically see Wedgetts in the posterior. I guess, could you just elaborate on that and kind of go into that a little bit?
Well, it depends if you're applying the dam by yourself. I apply the dam by myself quite a bit. If you were to use, obviously we do need a contact, but let's just say you have a situation where you can use Wedgett cord on the posterior and the anterior. What you would do is you would have the dam on the frame and punched, or you use the non-latex frame flexi dam, for example. You actually almost need someone to hold the dam and the posterior down. So you need an assistant if you're applying the dam in the posterior, because you need someone to hold the dam down while the other operator pushes the Wedgett cord through the contact. You could, in the anterior, it's not too much of an issue because I normally would get the patient to help me hold the dam in position. I have them use a finger. I place their finger where I needed it, and then I would use the wedget cord and place it. But in the posterior, you do need an assistant to help you. And so that's probably the reason why. Now, most dentists, you generally have an assistant. So really, there's no reason why they couldn't use wedget cords on either end. But it does take 2 people to apply it for the distal, the most posterior part. Does that help answer your question there?
Yeah, definitely. I mean, does a clamp provide greater retention, or keeping does the bow like help push the dam away from the tooth?
Yeah,
is there any other reasons why clamps, I guess, are the go-to?
Well, actually, theoretically, when an isolation is placed, you're supposed to go at least one tooth distal to the teeth that are being involved in the treatment. So let's say if you're doing restorations on 11, 12, and 13, then your anchor tooth would be 14. So if you put a wedget cord on the distal of 14 because number 15 is present, let's say, okay, so you have contact, that wedget cord won't retract. You're right about the bow retracting a little bit more, but it won't matter at that point because you're not doing any restoration on that tooth. You're doing the restorations on 11, 12, and 13. You see what I'm saying?
Yes.
But now, if you're doing an occlusal, let's say you're doing an occlusal on number 14, and you could conceivably get away with using a wedget cord without using a clamp. You're going to have a little bit of issue with that posterior part of the dam coming a little forward. Now, the assistant could use the handle end of a mirror to retract the dam back a little bit while the restoration is being prepared. So it wouldn't be that big of a deal. It's just that if you had to do an interproximal restoration, then you'd have to clamp number 15 in order to be able to get a matrix system on number 14. You see what I'm saying?
Yes.
Yeah. So it kind of depends on the scenario, what's being restored, but yeah, you do lose a little retraction on that posterior part of the dam. But like as I said, as long as it's only an occlusal, it wouldn't really make too much of a difference. But if I'm applying dental dam by myself, it's easier for me to use a clamp in the posterior and use the wedget cord in the anterior because I have no one to help me stretch that wedget cord through the contact.
Great. Thank you. Thank you very much.
Oh, yeah, no problem. Okay, so normally a couple questions did come up in the past, so I just want to review this. We have a stamp. Just make sure they use a permanent ink if they're going to stamp a box of dental dam, because if you use water-soluble ink, it's going to be all over the place. Our templates, just a quick history on the templates. Years ago, Hygienic used to make a template that had the holes. It was a plastic template, and it was actually pretty thick plastic template. And they perforated the holes, just like the same markings that are on the paper template, but the holes were already pre-perforated. So the template was always placed on top of the dam, and then you would just mark through the hole openings. Well, I think what happened is they went to the other plastic template that they have now, and they don't perforate the holes. I think it was because of a manufacturing issue. I don't really know for sure, but all I know is that the original template was discontinued. And the problem with the current plastic template is when you have dark dam, as you probably all realize, if you put the dental dam on top of the template, you can't see through the material to mark it. And so therefore, that's why we have our paper templates that come with our non-latex dental dam. Anyhow, what I wanted to show you on the upper right corner is that once you have your dental dam, if you're using a frame, and once you have the dental dam either marked or how, now see, I can just put the dam on the frame and I could punch my holes visually because I know where I'm going to put them. But some people can't do that. So the idea is to mark the dental dam some means. Then you can put the dam on the frame. And I'm sure most of you know that the hygienic frame is used. The dental dam goes on top of that. I bet you have had millions of questions about that. My dental dam won't stay on the frame, right? Is that right, everybody? They can't seem to realize that that's the correct way to do it, but you have to tell them. But anyhow.
Hey, Mary, really quick. What kind of stamp did you say you usually use for the dams? I actually just got this question yesterday, and I wasn't really sure.
The stamp? We make a stamp. We make a stamp that has the same markings as the template on the upper left corner image. And we also make a stamp for pedo. It's for it has the pedo arch, and it has an adult anterior marking.
It doesn't need to be like a certain type of ink or anything, though, does it? There's no like particulars on that, or? Well,
it's the one that's shown in the image in the middle. That's the 6-inch. That would be the 6-inch stamp. The 5-inch stamp is for the 5-inch dam, which is generally used for pedo, or you can use it for the adult anterior teeth, or you can also use it for just endo. So,
okay, gotcha.
Okay, all right. So what I'm trying to say is that if a dentist is using a frame, once the dam is marked, it's much easier to put the dam on the frame and punch your holes while the dam is on the frame. Because generally what happens, now this is basically setting it up for the wing technique, because you'll see in a few minutes that the wing technique, the dam, the frame, and the clamp are taken to the mouth as one unit. So that's what I'm showing here, punching the dental dam while it's on the frame. Much easier to do, and that's there was a question as to I think in terms of the technique, wing versus wingless. The dentists usually prefer the wing technique because everything is taken to the mouth as a unit. The drawback is that you have this little tiny anchor tooth hole that you have to make sure you line it up with the right tooth. And some people have problems with that when they're first learning how to apply dental dam. But basically the wing technique is the simplest technique to use when you're using a clamp. And the other thing I wanted to talk about is when you're punching the dental dam, and we have this diagram on our instructions about which hole sizes to use. And when we meet in June, I'm going to be talking a little bit about some troubleshooting things and a little more advanced applications, and we'll kind of get into stuff there. But bottom line is using the recommended hole sizes, your dental dam you'll get a better seal, and you'll be able to invert more readily. All right, let's move on. Okay, I'm going to play, this is the endodontic isolation wing technique, and hopefully my video should work. In the wing technique, the dental dam is placed on the frame, and a hole is punched for the anchor tooth. The wing clamp is inserted into the dental dam. Notice the safety ligation on that clamp. The dam and the frame and clamp are carried to the mouth as one unit. Once the clamp is seated, the dam is stretched off of the wings. Using a composite instrument and using the side of the instrument to stretch the dam off of the wings. That's important. An index finger may be used to stretch the dam from the lingual aspect. The isolation is now complete. The reason you want to use the, let's see, let me go on to the next slide here. All right. Oops, sorry guys, hold on a minute. I'm not sure how to, let me go back. There. The reason why you want to use the side of a composite instrument like I showed you is because people have a tendency to use a sharper instrument and that'll tear the dental dam. So the best way not to tear the dental dam when you're stretching it off the wings is using a blunted instrument such as a composite instrument and using the side of the instrument as I showed in the video. Are there any questions about the wing technique? Okay, now.
Actually, sorry, Mary, I do have one quick question.
Sure.
This is Taylor from Ontario.
Sure.
So I noticed on that video that you had the floss ligatures placed, and I was just curious, is that technique to do the proper floss ligature something that they're taught in school and that people would readily know, or is that something that we would need to learn and be able to teach them?
Okay. Actually, I'm going to do, for our next session, I'll do a video to show you how to do that. To answer your question, we were taught, and I think some of the dental schools still teach these dentists, future dentists, to use the little slip knot in the center of the bow. And the reason why that's not good enough is because when the clamp breaks, it breaks right in the center, which means you go to retrieve the clamp, you've got nothing on either end because the clamp splits in half. So the technique that's the technique I teach the dental students when I go into the dental schools because it embraces both holes and it moves across the bow and you are able to retrieve the entire clamp should the clamp break or become dislodged. So yeah, I'll teach you guys how to do that. I didn't have in this particular program, I didn't have a video for that, but I'll do a little videotape and then we'll go over that on our next session because there's a few things I wanted to show you there. Any other questions? Okay, so let's see, where are we? Now we got the wing technique. Now, winged, all right. Now, this is called the modified wing technique. Now, in the modified wing technique, we're using a wingless clamp. This technique is a go-to technique that I teach in terms of using a wingless clamp. If they're using wingless clamps, it's an easier way to use the wingless clamp. As I mentioned to you, the traditional way of using a wingless clamp is to place the clamp on the tooth and then stretch the dam over the clamp and tooth while it's in the mouth. And that's what makes using a wingless clamp difficult because the more posteriorly you go in the mouth, the more difficult it becomes to do that maneuver. In this particular situation, we're going to insert the bow of the clamp into the dam and go to the mouth. Here, let me play it, and I'll replay it if we need to replay it. In the modified wing method, the dental dam is punched for the anchor tooth, and an orientation hole is punched in the patient's upper left-hand corner. A wingless clamp will be inserted into the dental dam after water-soluble lubricant is placed on the tissue side of the dam. This is the elasti dam I'm using. Coming from underneath the dam and popping the bow through the hole. The dam is reflected back and taken to the mouth. Dental dam is seated. And the dam is opened. You can see why you need an orientation hole, as the dam has a tendency to turn in the mouth. At At this point, the dental dam is pulled forward to expose the remaining clamp and tooth. The frame is applied. I'm using a radiolucent frame. It's a hygienic brand. This is the correct way to use this frame. If you were using a metal frame, the dental dam would go behind. Using a composite instrument, you can fish the floss out from underneath. And you can secure it to the frame in this manner. The isolation is now complete. The reason why you want to attach the floss to the frame is so that if the clamp does pop off, it doesn't go across the room. You can retrieve it very easily. Any questions with the modified wing technique? Okay. So, in this particular isolation, we're using the wedget cord, and in our instructions for wedget cord, we show for an endo isolation a one-tooth isolation. But I had feedback from quite a few dentists that tell me that when you have only one tooth exposed using the wedget cord, it doesn't give them enough access to the lingual for their endodontic access. So I do a little mini isolation, and you'll see this in this video. This is the wedget cord application for endodontic procedures. 3 holes are punched. I'm using the frame Flexidam. The curve goes by the nose. It has an integrated frame, which makes it much more convenient for the patient and comfortable. Water-soluble lubricant is placed on the tissue side of the dam to facilitate its placement. The dental dam is applied to the teeth. Number 9 is going to be the tooth receiving the endodontic therapy, and it is placed in the center of the isolation. Wedget cords are placed on either end to retain the dental dam. The wedget cord is trimmed. Wax dental floss is used to pass the interseptal dam through the contacts. I'm using the loop technique. A composite instrument is used to invert the dental dam. By including 3 teeth in the isolation, it gives the operator more access to the lingual when performing endodontic therapy. When removing the isolation, the wedget cords are removed. Pull it through the embrasure area. Finger is placed in the buccal vestibule to protect the lips and cheeks, and the scissor is used to cut the interseptal dam, making sure the point of the scissor is facing towards inside the ledge. The dam is removed, and check for any missing pieces. Any missing piece should be retrieved from the mouth and brought to the area in question and matched up to make sure that all the pieces are removed. This now completes the isolation. Okay, any questions on this technique? Okay, let's move on. All right, now, the general field isolation, basically, this can be used for a quadrant isolation. A lot of times when a dentist is rather reluctant to use dental dam, the general field technique makes it really easy, and you'll see in the video how easy it is. And they may want to start with this type of a technique. Eventually, they'll realize the benefits of using dental dam because they'll say, "Wow, I could see better. Everything is isolated." The downside, of course, with this technique is that there's no interseptal dam, so you don't quite get the retraction that you normally would get when you have interseptal dam. But for someone who's reluctant to use dental dam, this is a good starting point. So let me play this for you. In the general field isolation, 3 holes are punched in a dental dam. I'm using the frame flexidam. A wing clamp is inserted into the anchor tooth hole. We don't use lubricant when we're using the wing clamp. We lubricate normally the remaining holes if necessary, but not the hole that gets the wing clamp because the dam will slip off the wings. It's cut between holes 1 and 2. Dental dam is carried to the mouth. And stretched anteriorly. A wedged cord is used to anchor the dam in the anterior segment of the isolation. Wedged cord is trimmed. The dental dam is stretched off of the wings using the side of a composite instrument. Index finger may remove the dam off the wing on the lingual. Wax dental floss is used to carry the interseptal dam through the mesial of the molar. This is the loop technique again. A composite instrument is used to tuck under the dental dam to provide a moisture seal. This isolation does provide isolation of the lips, the tongue, and the cheeks. As far as infection control, it's not the most ideal, but of course it is better than nothing. As you can see, it does provide you some method of isolation. This is indicated in cases where using a traditional method of isolation where the interproximal dental dam is placed between the teeth. Or also when you're working on children, since they're moving targets, this is a quick and easy isolation to use in such cases. So the isolation is now complete. Okay. Any questions on that general field? Okay. Let's see. Now, I'm going to show you a Wedgett's cord trick. So we're doing a mini quadrant isolation, which is 4 teeth, and I'll play the video clip. When using Wedgett's cord to isolate for a mini isolation, punch 4 holes. Use water-soluble lubricant on the tissue side of the dam. Take the dam to the mouth. Using a Wedgett cord to anchor one end of the isolation and carrying the dam to the end of your isolation. For tight contacts, use wax dental floss to pass the dental dam through the contact, leaving a loop. Take your Wedgett cord, fold it over, holding the long end, leaving the short end go. Pull through the embrasure. Trim the Wedgett cord. And continue on with your isolation. Pass the wax floss through the contacts to get the remaining dental dam through the contact using the loop technique. The last step is inverting the dam. Oh, goodness. Sorry, guys. I didn't realize the phone rang at that time. Anyway, you get the idea. Any questions on that Wedgett cord trick? Okay. Let's. All right. So you're going into an office, and the doctor's. No, I don't know about using dental dam. I know I should use it. I was taught it in school, but hey, it just seems like it's just too difficult to get started using it. So you could suggest, hey, doc, you don't need to invest a lot of money in equipment. You can get this simple dam kit. We have other kits available too. As you progress into more of your techniques, you can get the organized Fiesta Dental Dam clamp pack. If you're teaching your auxiliary how to apply dental dam, the color coding makes it easy to ID which clamps to use. And of course, the frame Flexidam, you definitely want to introduce that. And the dental dam Wedgett stabilizing cord. You could, just the idea where they don't have to use the clamp sometimes is definitely a winner. And just say, look, just gradually increase your usage. Start out with, you say your occlusal restorations, because those are much easier to isolate. And then, as I mentioned a few minutes ago, that most states have permit placement, their auxiliaries to permit placement of dental dam. So there's training options for the staff. So these are just simple ways where you can meet some of the objections of using dental dam. And of course, we know that today it's the coronavirus, right? God knows what we have to see in the future, what infectious diseases are out there. And so I think it's a good reason to use dental dam regularly. And I want to thank everybody today. Are there any other questions as we conclude our program?
Hey, Mary, I've got another question. when do dams typically tear? Like what is the most common scenario for a dam tearing? Is it when you're putting it on the frame? Is it when you're stretching it over the clamp? What do you see?
Yeah. Number one, when they're stretching the dam off the wings of a clamp, if they're using an instrument that has a sharp edge, like sometimes they'll use an explorer, sometimes they'll use excavator, for example. Those are instruments that have sharp edges to them, so they're going to cause the dam to tear. So that's why I suggest using the composite instrument and the technique that I was recommending on the video. So that's one time it'll tear. Also, it'll tear if they're putting the wing clamp on the tooth and trying to stretch the dam over the clamp and the tooth and everything else on the wings, because that's not how the wing clamps should be used. They're trying to use a traditional wingless technique with a wing clamp, and the dam will end up tearing because it's just not intended to be stretched to the extent of all that business, particularly the wings, you know what I'm saying? So those are probably most of the times. The other issue is like when you're doing an interproximal preparation. Well, for example, I know that Garrison has what they call fender wedges, and what they're meant for is they not only protect the tooth structure, but if you're using dental dam, it'll help protect your tearing the dental dam when you're doing a class 2, for example, where you have to go interproximally. That's when the dental dam could tear. You could catch it with a burr, for example. Now, if that were to happen, it's not like it's the end of the world. If they did just snip the dam in that specific area, they could tuck it lingually and buccally. And if they have interceptal dam on the rest of the quadrant, that little bit of exposure isn't going to make that much difference. They would probably get very minimal moisture, if at all, as long as they're able to turn that portion of the dam under to get it kind of like inverting it, basically. So those are kind of pretty much the scenarios there. Sometimes people on the metal frames, I've seen dental students do this. They think that you've got to poke a hole in the dam in order to get it to stay on the metal frame. So I instruct them, no, that's not what you do. Because that will cause the dam to tear in if they try to do that. That's pretty much it. I can't think of any other basic scenarios where there may be an issue. Any other questions?
Thank you.
Hey, Mary, is there any advantage between, or I guess competitive advantage between different dental dam clamps? I know most on the market are stainless steel, but I often find people use our dams, but then they'll use the ivory by Colzer, I believe it is, for the clamps. And I'm not sure if that's just for what's in stock at the dealer or what, but I was wondering if there's just any competitive advantage over one over another or whatnot.
I think mainly the reason individuals pick certain clamps is because of their usage and also what they'll learn in dental school too, what they've used in dental school. When you guys go into the dental schools, like for example, our System 9 clamp packs, all right, those clamps have equivalencies to other manufacturers' clamps. As a matter of fact, I know Kyle, I'd given him a conversion of all the different clamps. Kyle, do you still have that information?
I do, yes.
Okay. Maybe that might be something that would be helpful for the reps. But bottom line is like an 8 in our clamp is the same as an 8 in Ivory's in any other brand. There's some of the clamps they're just identical reproductions. They're just an Ivory brand or a hygienic brand or whatever brand, okay? So that's a no-brainer. Where you get a little tricky is they say, like number 26, an Ivory 20, I believe that's an Ivory 26. Quite personally, I don't pay too much to the numbers, but an Ivory 26 is kind of a universal molar clamp. And so our equivalent to that would be like a W56. By the way, the Ivory 26 is a wingless clamp, even though it doesn't have a W before the number. So this is another thing that confuses people, because not all manufacturers put a W before their wingless clamps. So essentially, most of the companies, they put high quality stainless steel into their clamps. It just has to do with the style and the usage. But if a doctor's using a number 8, a 14A, he's using a 9. I mean, those are exact duplicates of styling as our clamps. So there's no reason why we can't convert them over very easily to our clamp pack and our clamps. So I don't know, some of the dental schools I noticed, they'll have a combination of ivory clamps, and so I try to encourage the reps when they do go into the dental schools to, let the particular faculty members know that we have the same identical clamps. You know what I'm saying? I've had one school where they order our clamp board, our color-coded clamp board. They'll order that, but then they have another brand's clamps. So it's like, well, why do that? Particularly if they have 8s and the 7s and stuff like that. So I have to say that in the dental schools, it's very political. You get these professors that have been in dentistry, some for longer years than they should be, and they're on the committee for instrument committee, and so then you got to deal with that situation. So I understand what you guys go through when you're trying to convert these dental schools, because sometimes it's just very difficult to do. Hopefully, I have had some of the schools that I go into, they have purchased more of the hygienic accessory products. They usually purchase the hygienic dam, but the accessory products, sometimes it's a kind of little harder sell. So, it's just a matter of educating them, I guess. So I think that clamp conversion chart might help you on those clamps that aren't exact replicas of our clamps. Any other questions?
Mary, this is Kevin Bielek. I have 2 questions for you.
Sure.
One, have you ever worked with the Hufredi Black Line rubber dam clamps? And is there any clinical benefit to that color code?
To be quite truthful with you, I'm not familiar with that line of clamp. Is that a recently new system that they introduced, or?
I think it's within the last 4 or 5 years, but I've just noticed some of the doctors using them, and I was just wondering if there's a clinical benefit to it.
All right.
I'll send you some info so you have it, so you can just look at it, but I don't know if you've seen it at all.
What are they called? Black line?
Yeah, they're called Black Line rubber dam clamps from Hufredi.
Does it have to do with the color or something? Are they dark?
That's what I'm trying to figure out. They are dark colors, so they're also matte finish. But I was just curious if there's a benefit.
Okay, you know what? Remember when let's see, I'm trying to think what company it was. Remember when they when one of the companies came out with the instead of the pardon me, I'm trying to remember what like how we had the color coded clamp pack. They're not polished, right? They're a
matte finish.
Okay, remember prior to that clamp pack coming out, I can't remember which company it was at the time. They came out with a matte finish clamp, and so it was around that time when I approached Mr. Sullivan, and I said, well, with our clamp pack, I said we could do a clamp pack and do matte colored, matte finish clamps, but color code them, which makes them unique for identification. So he liked the idea. And then, we worked on getting the clamp pack out, which took a few years to do that. So I'm thinking if the Black Line has it's probably a matte finish, just from what you're describing, it's a matte finish clamp, and it has a little darker color. The whole purpose of the matte finish is that when endodontists use their system, their technology, the microscopes that they use, there's a tremendous amount of light that will reflect off of a polished clamp. So the whole purpose of the matte finish, and I'm thinking the black line probably has the same principle. It doesn't give you the reflection off of the clamp. And that's probably, do they have like standard sizes at 8, 7, you know, do they come in a set? Do they have a whole big line or a limited line?
Their offering's very similar to ours. There's a couple that we don't make, but that was just more curious. If I just swapped someone out, would they notice any big difference from them?
Well, ours aren't going to be as dark, you know, because ours are still matte finished though.
Right.
So, I mean, you're not going to get the glare from the matte finishing. So you could switch them out. The only thing I could see is that the black line is probably the first company had trademarked the matte finishing. So that's why they had to come out with a black line, because they couldn't duplicate the trademark. You see what I'm saying? But I think the principle behind it is the same thing, is to diminish the amount of light reflected off of the clamp. And I think that's the whole purpose of that black line. Not even looking at it, but I would think that would be my judgment there. Particularly if the clamps have the same numbers, you know, 8, 7s, 4s, whatever they are, you know what I'm saying? The jaw styles and everything else are the same. The only difference is they're tinted or they're making them a black matte finish. What was your second question?
Is there clamps that we make with Coltene that have uneven jaws, so one jaw higher than the other?
Yeah, the 12A and the 13A. By the way, if you're in an endo office, the 12A and 13A is a very popular endo clamp. Normally that clamp, the serrations on that clamp will give the tooth more gripping power. It stays on the tooth more readily. And the reason why it's popular for endodontics particularly is because usually, I mean, they'll get some gingival type scenarios, but they also get cases where it's a fully erupted tooth, but it's really structurally compromised, very badly structurally compromised. So the 12A or 13A will stay on those teeth. And again, the 12A, the buckle is for the lower right and upper left, and the 13A, it's lower left, upper right. So you can use those on either arch, even though the jaws are flat. But if I have a tooth that's structurally compromised, like where there isn't hardly any wall left, I'll use those, whether it's a maxillary or mandibular arch. I mean, and the endodontist will like those clamps. So usually I find that endodontists use those very readily. Just remember that the wide side of the jaw goes on the buccal aspect of the tooth, because I've seen people put those on backwards. Any other questions?
Thank you.
Anybody else? I guess not. Well, listen, thank you very much. I appreciate your tuning in today, and I hope I have imparted some information that will help you in your search for better product purchases.
That was great, Mary. Thank you very much for making the time for us today.
Thank you.
You're quite
Thank
welcome.
you, Mary.
Thanks, Mary.
Happy dental
Look
damage.
forward to the next session.